Hello, my name is Dr. Hope Mitchell. I am a board certified dermatologist. The title of my presentation is Melanin and Melanoma. Today, I will be discussing melanoma as it relates to the Black community. Melanoma, also known as malignant melanoma or cutaneous melanoma, is a type of skin cancer that develops when melanocytes, the cells that make melanin, the pigment responsible for tan and brown complexions, start to grow out of control. While melanoma is the least common of the three main types of skin cancer, which include basal cell carcinoma and squamous cell carcinoma, it is the deadliest because it is more likely to metastasize or spread to other body parts and have a delayed diagnosis and therefore late treatment. In general, 70% of melanomas arise on normal appearing skin. The other 30% develop from a pre-existing mole. There are four major subtypes of malignant melanoma. Superficial spreading melanoma is the most common type of melanoma. It is a slower growing melanoma that tends to grow outwards and on the surface of the skin as a dark patch or spot, instead of growing downward and deeper into the skin. It makes up about 70% of all skin cancers. Nodular melanoma is the second most common type of melanoma skin cancer. It tends to grow quickly and downward into the deeper layers of the skin as a dark bump or nodule. It makes up about 15 to 20% of all melanoma skin cancers. Lentigo malignant melanoma most commonly develops in people older than 60. They are more common on the face, ears, arms, or areas that have gotten a lot of sun exposure. They make up about 10 to 15% of all melanoma skin cancers. Acrolentiginous melanoma, the most common type of melanoma found in Black people, is not related to being exposed to the sun. Acrolentiginous melanomas commonly occur in areas that are hard to see, like the soles of the feet, the groin, on the palms, and even under the nails in Black people. Interestingly, Bob Marley was diagnosed with acrolentiginous melanoma at 36. He attributed a dark spot that occurred under his toenail to a soccer injury, but it was not an injury. It was a melanoma that tragically took his life. Melanomas can also occur in the mouth and in the eyeball area. So let's review some key statistics. Black people have higher percentages of acrolentiginous melanoma than their Caucasian counterparts. The risk of melanoma increases as people age. The average age of diagnosis is 65. It is not uncommon, however, to see cases of melanoma in those as young as 30. Skin cancer can affect anyone regardless of skin color. In Black people, melanoma most commonly occurs on areas that get little sun exposure. Up to 60 to 75% of tumors arise on the palms of the hands, soles of the feet, and under the nail areas. In people of color, including Black people, the plantar portion of the foot is often the most common site of skin cancer, being involved in 30 to 40% of cases. Anyone can get skin cancer, including Black people, who die at a disproportionately higher rate from melanoma than their white counterparts. Although skin cancer represents 1 to 2% of all cancers in Black people, unfortunately, many Black people are diagnosed with melanoma skin cancer at a later stage and therefore have a poor survival rate when diagnosed. A 2019 CDC publication titled Melanoma Among Non-Hispanic Black Americans found that from 2011 to 2015, more non-Hispanic Black people were diagnosed with melanoma with distant metastasis or unstaged melanoma than non-Hispanic white people. If you look at the graphic, what the graphic is showing is that when you compare non-Hispanic Blacks to non-Hispanic whites, the entire group, what we're seeing is that there is a higher percentage of distant, regional, and localized melanoma compared with other populations. In fact, the CDC publication also found that the 5-year melanoma survival rate was 66.2% in non-Hispanic Black populations compared with 91% in non-Hispanic white populations. The disparity gap is likely contributed to a lower public awareness of the risk of skin cancer in Black people, a lower index of suspicion for skin cancer from healthcare providers, or even an overconfidence in having melanated skin.